you can care of people that have a disease now, but are we able to prevent for them to have those diseases?
Quebec's health minister Christian Dubé is promising a shift towards prevention, with the goal of cutting preventable diseases and early deaths linked to socioeconomic inequalities by 10% by 2035. The concrete action plan is still to come, but Dubé said on Thursday that the government will prioritize measures like earlier screening for chronic illnesses and tackling tobacco use. The ministry is also framing the move as a cost-cutting one, estimating that every dollar invested in prevention would save the healthcare system around $14.
Something like 15-20% of chronic disease could have been avoided. So that's important. So that's the reason we're looking at prevention.
Dubé told reporters Thursday that Quebec would be investing $5 million in screenings and pilot projects to better detect people at risk of developing chronic illnesses. He says that investing in prevention will require an effort from multiple of the province's ministries, which is why an additional $5 million will also go towards expanding access to physical activities, particularly for groups like seniors, through programs overseen by the Ministry of Sports and Recreation.
In a policy like we announced today is to put everybody together to say how much are we putting right now.
With healthcare already taking up more than 40% of the province's budget, Dubé says the current path for the healthcare system is unsustainable. He argues that prevention will save money in the long run.
No question about it, every dollar in prevention will save.
The province is also committing $4 million towards projects aimed at helping people quit smoking. While advocates say funding is welcome, they also say the province needs to go public with longer-term commitments if they plan on launching this strategy over the next 10 years.
To have funding for at least a couple of years already announced, so we have long-term funding and we can reach the ambition that we want to have.
Others say that prevention can have an even bigger impact on vulnerable communities. Indigenous health advocate Stanley Volant says target measures are even more important given the high rates of chronic illness within Indigenous communities.
60% of people are overweight, 40% of people over 40 years have diabetes. This has a major impact on healthcare.
City News spoke to some Montrealers on Thursday who had mixed reactions to the province's new prevention strategy.
Christian Dubé, he made the best for what he thinks it could be good about the money.
We need to invest in healthcare because we're getting older. Young people stay young, but older people are the ones who come in most often, which means more illness. In Montreal, Zachary Cheung, City News.